the Skene's glands or the paraurethral glands. So, these are again small tiny bulb like structures which are present surrounding your pee hole. So, you can see this is your pee hole. So, these are the two tiny Skene's glands which open into your pee hole. The Skene's glands are responsible for maintaining the particular pH and lubrication of your pee canal, that is your urethra. Your urine is quite acidic. So, the urine is always acidic, either lesser or more, and it has a potency to damage your urethra. So, the Skene's gland or the paraurethral, para means surrounding, urethral means the urethra. So, these Skene's gland, they secrete or they release some fluid to keep the urethra moist, lubricated and to maintain its pH and to protect it from the acidic urine. Some people believe that during sexual activity or during orgasm, sometimes the Skene's gland, they also contract along with the Bartholin glands, giving a feeling of ejaculation. So, female ejaculation, which is known as squirting. So, some researchers believe that during squirting or female ejaculation, there is a forceful contraction of the Bartholin glands and the Skene's glands as well. Vagina. Have you ever wondered from where did the word vagina came? So, again it has a Greek or Latin origin, which means the sheath of the sword. So, vagina means the sheath of the sword. Let us look at the vagina. For the understanding, you can see we are talking about this part in a female's body. So, if you are visualizing this and if you are seeing me, so this is the back and this is the tummy. Similarly, the back and the tummy. So, when we talk about the word vagina, that means the canal which is present in your pelvic area, the second canal present in your pelvic area. So, in this image, now you can see that this is your front bone, we term it as the pubic bone, and this is your spine or your backbone. We call them as sacrum and the coccyx. Inside this you can see three organs. The first is your bladder, the urinary bladder, that is the small pouch where the urine is stored. The second is the uterus, or you can say the womb where the baby grows, and the third is the rectum or the last part of the intestine. Beneath your uterus you have a canal, a smooth muscle canal, which is called the vagina. So, vagina was not what you saw in the vulva. Vagina is the whole canal, and if I zoom the picture more, you can see that this canal is not straight. Okay, this is not straight. It has multiple rugs into it. That means you can say the ring like structure forming the inner layer of vagina, and this ring like structure is being formed by the intravaginal muscles, or you can say the smooth muscles of vagina. So, these are your smooth muscles of vagina or your intravaginal muscles, which forms this rug like structure or the ring like structure. This is a very important structure because it provides the elasticity to the vagina. So, vagina in its unaroused state, that means when a female is not aroused, it has a length which is roughly around 3 inches, and during the sexual activity, that means if the female is aroused, at that time the length can increase up to 7 to 9 inches to accommodate the penis, and that elasticity is provided by the rugs, or you can say the smooth muscles of the vagina. Also, this vaginal canal, what you can see here, you can see it is a tunnel, right, a canal, a tunnel. It has multiple cells which we call as the mucus secreting cells, or you can simply understand those are the cells from where your vaginal discharge is produced. So, the vaginal discharge, whatever you are experiencing, is produced by the cells which are present in the vaginal lining or the vaginal canal. And this vaginal discharge is responsible for keeping your vagina healthy and preventing any infections to settle down there. This rugs, as a female grows old, that means during menopausal age, as the estrogen level reduces in the body, these rugs can become thinner and almost the vagina will become flat. So, that also results into dryness and lack of firmness of the vagina. So, if the rugs are lost, which happens after menopause, that can lead to vaginal dryness, that can lead to loosening of your smooth muscles, and that can also make your vagina less elastic. So, this is your vaginal canal or your vagina. Also, during the childbirth, that means when the baby is getting delivered, even at that time the vaginal smooth muscles or the intravaginal muscles, they also relax, or they also allows the baby to come out. And when we talk about the vaginal muscles, that are your pelvic floor muscles, these muscles are located at the outer 1/3. So, here where you can see here, this is how your vaginal muscles or your pelvic floor muscles are located, and they give a firm grip, or you can say they give a tight grip to the penis during a sexual activity. So, this is how your vaginal muscles or your pelvic floor muscles are located at the outer 1/3 of your vagina. The vagina is connected with the uterus. It is connected with the uterus and it is a passage. So, that is why many a times the vaginal canal is also termed as a birth canal or the birth passage, because that is the area, that is the place through which the baby from the uterus will be pushed out in the world. So, this is the birth passage or the birth canal, that is your vaginal canal or vagina. So, now you can understand the difference between the vulva and the vagina. These are two different terms.